I'm Mike Royer with an extended interview in this Health Matters Web Extra. Hello once again, everyone. This is Mike Royer welcoming you to another edition of Health Matters, a program that you can hear through a podcast or watch these entire interviews on WVUA 23 or the website at University Medical Center here at the University of Alabama. Dr. Richard Friend is the Dean of the college, Professor of Family and Internal and Rural Medicine. Previously, he served as Director of the University of Alabama Tuscaloosa Family Medicine Residency Program, and he wears several other hats here at the university. Dean Friend, it's good to see you again, sir.
Good to see you. Thank you for having me.
We covered recently the opening of the new clinic over in Northport. We've talked about that before. I know you're pleased with how that's going so far.
We are. We're excited that we can provide more access to the community. We're working very hard at making our patient experience even better from the time patients request an appointment through the time they see their doctor and get their follow-up.
This subject we're talking about today, I think, is one of the most exciting ones we've talked about. We talk with you and all of the physicians that you supervise and that work in the college, and we talk about how to keep people healthy and how to deal with health problems, psychiatric problems, OBGYN problems. Today we're talking about all problems, and through new technology and through a partnership with the University of Alabama, with you, and with Cera's Health, a new way of taking care of maybe marginalized senior adults, people who don't have access to medicine, and not every visit will be in person. You're going to be able to take care of people remotely. I know you're excited about this. First of all, tell us about the partnership and what it is about.
So we've been working on this partnership probably for the last year with a company out of the Northeast named Cera Health. And this company is really on the cutting edge with Bluetooth technology and healthcare devices. And as we've worked our way through the partnership, we've sort of solidified 4 areas that we're going to be working with them on. And these are all with remote devices in conjunction with a care manager. So it won't just be a device and a lot of data collection. It will also be a human being following trends. There's 4 devices that we're currently going to employ. One is a weight scale for those patients that might have heart failure or obesity or other weight-related illnesses. One is an ambulatory blood pressure cuff, which is completely 4G, so patients won't have to have internet and will be able to track their blood pressure. One is a watch. It's not an Apple smartwatch. It's their own device that they've patented, and it measures several things: blood pressure, heart rate, pulse ox, steps, calories, and heart rate variability, as well as some sleep parameters.
So, for those of us that don't know all the meanings of all of those things you just said it will do, my physician and the caretaker of that data that is sent in remotely can monitor my health, keep an eye on. If I get in trouble, I assume they'll get a notification that this is out of whack, and you don't have to necessarily be face-to-face with a healthcare provider. Is that right?
That's right. The idea is not to replace the healthcare provider.
Of course not.
The idea is to help the transition from the patient from the hospital to the home or other healthcare setting when they're discharged from the hospital, in conjunction with a care manager that will contact that patient within 48 hours and then schedule a face-to-face visit with their primary care doctor in 7 or 14 days. And we will help keep them out of the hospital for 30 days. So it's really an extension of our workforce and of our monitoring abilities designed to help keep patients healthy.
Before I ask you about the cost of devices, let's think about the cost of not being in the hospital. Instead of saying, well, you're doing better, but I want to watch you a couple of more days, you might be able to watch me a couple more days, sending me home. Is that correct?
Right. So one other device I forgot to mention is the 24-hour ambulatory glucose monitor, which are widely available on the market.
And very important for?
Very important for diabetics or those experiencing high blood sugar or low blood sugar or certain other disease conditions where sugar may be an issue. So that's also a device.
Is this partnership and these devices in operation yet, or are you about to launch this?
So our official launch date is February 2nd, and we will be rolling these devices out on our inpatient teaching service to begin with on February 2nd, and then we will gradually expand that service coverage, and those are to start out to our Medicare patients.
And a relatively healthy person that doesn't have any pre-existing condition or a condition that you are as a physician concerned about wouldn't necessarily participate. This is for people who are at risk of an event that could really endanger their lives. Is
That's
that
right.
correct?
Hypertension, diabetes, and those with chronic health conditions, perhaps dialysis patients, perhaps bad asthma or chronic obstructive pulmonary disease, those that might have COVID in the outpatient setting we can monitor. And the great thing about this company is they're really on the cutting edge of producing new devices. These are all FDA approved devices. So the patients will actually get these devices for free when we talk about cost.
Wow.
We'll register them. They'll have to upload an app on their phone. We will give them the devices. And then at the end of 30 days, if they choose to stay enrolled with us, we will continue to monitor them in 30-day increments and do something called remote patient monitoring.
As long as the numbers that you look at and understand are okay, you wouldn't need to see them. If you see something out of the ordinary, what then would happen?
Right, so these vital signs are monitored 24 hours, 7 days a week, and we have certain parameters where we will be contacted by the company as this may be an issue. You may want to reach out to the patient and have them in for a visit, or there's really nothing to do because we know the patient well. So it's sort of eyes on the patient all the time that really helps us extend coverage no matter where the patients are, particularly in hard-to-get areas, rural areas, patients that may not have transportation.
Dr. Friend, tell us about operation of the devices. I'm fortunate that with this device, the cell phone everyone has, if I have a problem with it, all I do is hand it to a college student and they fix it for me. Are the devices you're talking about, no matter what they will be monitoring, something you need training on, or you just wear it and it does the work?
So we will train the patient. Basically, you wear it and it does the work.
Okay.
But we will train the patient on the device, the operation of the device, the number to call if they're having a problem with the device, a number to call if they're having a replacement, and a website that has all the information.
It would be unfortunate if you told us about this and said, yes, it's going to be very expensive, and if you can afford it, you can have one. This not only will go to anyone, but especially those who couldn't afford it, they're going to benefit from this.
Yeah, from an enrollment standpoint, those patients with Medicare or a Medicare Advantage plan are eligible for this service. Medicare and those Advantage plans actually have billing codes where we can recover the cost of the device by providing the service. So that's the group that needs it the most, the folks that have a chronic medical condition or multiple chronic medical conditions, and everybody over 65 is enrolled in Medicare. So that's the group we're looking at. Now, younger patients that may have Medicare for a chronic illness, they're also eligible.
Very good. Medicare, Medicare Plus eligible.
Correct.
If you don't have Medicare, are you able to purchase a device if you want, or are you not that far down that road yet?
Yeah, we're not that far down the road yet. But I do envision us expanding this to all of our academic services. We have 4. We're going to start off with 3 of our 4. And then I envision us being able to sign up the patients directly from clinic. So we have patients that come in that have blood pressure that's very difficult to manage or diabetes that's very difficult to manage. We will just go ahead and have a care manager meet with them right then, sign them up for the device, give them the device, have them enroll, and then we can enroll them in remote patient monitoring and chronic care management, which are 2 separate services.
We've done so many stories about, and Health Matters segments about rural health. Folks who live an hour and a half away from Tuscaloosa or further than that from Birmingham and can't get to their physician or an emergency room very quickly. This must be a major breakthrough for folks who live out in rural areas.
Well, I think it is. And, you know, we have clinics in Sumter, Marengo, Fayette, and Pickens County, as well as Northport. So I think our reach and our ability to continue to provide care outside of the office in a very cost-efficient way has the potential to really change health outcomes, not just in West Alabama, but across Alabama. And we're looking into rolling this out across the Southeast because the health outcomes in Louisiana, Mississippi, and Alabama all tend to be at the bottom of the list.
I'm assuming, I don't need to assume, I know that also you've given thought to security, personal information. These devices don't transmit Social Security numbers, they transmit health numbers that could belong to anyone, I assume.
Yeah, so we've done a lot of due diligence with our responsibilities with protected information.
Yeah.
And all of our cybersecurity and HIPAA professionals have all signed off on this, as well as the company that we're dealing with. So we feel comfortable about the data we're collecting, the use of that data, and the ability to keep that data safe.
What would be your guidance as people listen or watch this interview and they say, oh, I want to be involved in this, or my aunt, uncle, my parents need to be involved with this? What time frame would you say to reach out to physicians and to the University Medical Center? Give it some time first, or is it fine to go ahead and try to enroll now?
Well, I think those patients that are in the hospital with our training programs are going to begin to see this. We have about 5 to 8 discharges every day that we think will qualify. Now that number is going to grow very quickly. If we include the Medicare Advantage plans, that number's in the high 20s.
Wow.
So if you are unfortunately admitted to the hospital, we're going to touch you first. But those patients that visit our clinic, UMC Maine, UMC Northport, or one of our rural areas, probably within the next 6 months, certainly within the next year, will have an opportunity to sign up with these devices and will be able to help monitor them.
Let's finish with your thoughts just about the excitement of this technology. You remember rotary phones and technology and charts you filled out by pen and then finally figured out how to make copies of them. This technology sounds futuristic, but it's here now. How exciting is that to you?
It's very exciting, and as I have more meetings with this particular company, they really are on the cutting edge. There's going to be more disease processes that come online. They're doing work with post-op patients and monitoring of those patients. They're doing work with stroke patients and monitoring of those patients. So I know that we can't at the university, although we have great scientists at the university, we can't keep up with that technology as fast as it gets to the market. So that's why we partner with this company, so that they can bring new products on the market and we can then translate that benefit into the health care of our patients in our region.
They do the complicated technology, you keep doing the medicine, and together can serve a lot more people at ultimately a reduced cost.
We do, and the real breakthrough has been that CMS and Medicare has realized that if we have these frequent patient contacts and this ongoing data, that we can keep people healthier, we can keep them out of the hospital, we can keep them more engaged in their health care, and through that, there's a real cost savings to the Medicare program.
Very good. Dr. Richard Friend, Dean Friend, we appreciate you and everyone at the University Medical Center. Thanks for sharing this exciting news. It's one we'll want to follow up on in a few months and see how it's going and get an update from you. Thank you very much for your time.
Thanks for having me.